Welcome to the deep dive. Today we're diving into a topic that demands a lot of sensitivity and care. It's about understanding those initial steps and the resources that are out there for people who've been through sexual assault.
Thanks for having me. It's so important to be having these kinds of conversations. To help guide us, we'll be looking closely at the first 10 pages of the SACASA Survivor Handbook. SACASA, which stands for the Southern Arizona Center Against Sexual Assault, is a vital resource in our community. They offer support, advocacy, medical forensic services, and work to prevent sexual assault. Their belief, and one we strongly echo, is that every single person has the right to a life free from abuse and violence.
No doubt about that. So for this deep dive, we'll be walking through those first few pages, chronologically, seeing what advice the handbook offers in the immediate aftermath of a recent sexual assault, the options for medical care, and how people can access the support that's available. It's really important to emphasize that this information is relevant to anyone affected by sexual violence, regardless of their gender.
And for you, our listener, if you're dealing with the aftermath of sexual assault, it's totally understandable to feel overwhelmed. Our goal today is to lay out clear step-by-step information and to highlight the resources that are here to help.
Great. So let's jump right in, starting with the immediate support outlined on page 2 of the handbook. The first thing it emphasizes is that urgent need to get to a safe place as quickly as possible after a recent sexual assault.
That sense of safety is absolutely crucial. The handbook then immediately points to a vital resource, the SACASA 24-hour bilingual crisis line. You can reach them at 520-327-7273, or if you're calling from outside the local area, toll-free at 800-400-1001. This line is open 24/7, it's anonymous, and serves everyone in southern Arizona. And they also have TR Relay text message capabilities at 520-327-1731, which makes help even more accessible. That immediate access is so important. The handbook also suggests reaching out to someone for support, like calling the police, a trusted friend, a family member you feel safe with, or, of course, SACASA. And it specifically mentions how valuable it can be to have an advocate by your side during a time like this. What is it about having an advocate that's so helpful in those initial moments?
Well, having an advocate there who understands the nature of the crisis, who isn't emotionally involved in the same way a friend or family member might be, can be incredibly supportive. They can be that calm presence, help you understand your options, even speak on your behalf if you're not up to it. The handbook then gives some very practical advice about preserving potential forensic evidence. It suggests, if it's possible, and if you're even thinking about this option, to not change clothes, shower, bathe, or wash, because that could preserve evidence if you decide to pursue legal action later. It's important to remember that this is your choice and your well-being comes first. That makes sense, especially if there's a possibility of an investigation. The handbook then talks about immediate medical care, recommending Tucson Medical Center or Banner University Medical Center. It also smartly points out that if there are serious or life-threatening injuries, the closest emergency department should be the first stop.
Absolutely. Getting medical help is always the priority if someone is injured. After that, the handbook really stresses your right to have an advocate with you at the hospital. Ideally, the hospital staff will contact SACASA right away, but you always have the right to request this yourself, and you definitely should if it doesn't happen. They mention the Sexual Assault Response Service, or SARS advocate specifically.
So a SARS advocate is someone who'd come directly to the hospital to be there with you.
You got it. That's exactly right. They're specifically trained to provide immediate support and resources in the hospital setting. The handbook also makes a really important point clear. While the hospital will usually contact law enforcement, you are absolutely not obligated to speak with them if you don't want to, not then, not ever. That decision is completely yours.
That's so critical for people to know. Page 2 also talks about drugged sexual assault, which is a really awful thing to go through.
Absolutely. The handbook urges anyone who suspects they might have been drugged, and remember, this includes alcohol, to get medical attention as soon as possible, especially if there is any loss of consciousness or a period of time they can't remember. That quick action is so important.
The urgency there really stands out. What makes seeking medical care so important, even if there aren't any visible injuries from the assault itself?
What's essential to understand, as the handbook points out, is that the drugs sometimes used in these situations are metabolized very quickly by the body. That means your body processes and eliminates them fast, often in just a few hours, which could make them undetectable in standard tests if too much time passes.
That's pretty scary.
It is. The handbook describes these drugs as having this sedative and hypnotic effect, which can make it almost impossible to fight back against an assault, and often leads to memory gaps. It also says that someone might act in ways they wouldn't normally while under the influence of these drugs and have no memory of it later. That can be so disorienting and isolating.
It's hard to even imagine that feeling of lost time and not being in control.
Absolutely. And the handbook really stresses that urine, not blood, is often the most important sample for detecting these drugs, and the very first urine you pass after waking up is the best sample. But here's a really critical detail. The handbook cautions that typical hospital labs might not routinely test for these specific substances in a standard urine analysis.
So if someone suspects they were drugged, they need to specifically ask for a toxicology screening.
That's a crucial question to ask the medical professionals. Now, moving on to page 3, the handbook tackles the general need for medical care after a sexual assault.
And it's a pretty strong recommendation, right? It emphasizes both immediate care and the importance of follow-up in the weeks and months that come after.
Exactly. The handbook makes it clear that seeking medical care isn't just about any immediate injuries, but also about minimizing the risk of infections and addressing any other health concerns that might come up. It then lays out what someone might expect if they go to a hospital emergency department.
Walking into an emergency room after something so traumatic can be really intimidating.
It definitely can. That's why the handbook reminds everyone that SACASA can send an advocate to be at the hospital with you, to provide emotional support, crisis intervention, information about resources and referrals, and help you understand your rights and options. That kind of support can make a big difference in navigating that initial medical visit.
So having an advocate there seems like a huge help. The handbook also points out that emergency rooms can be really busy and overwhelming places.
Right, and it notes that the hospital should offer you a quiet place to wait. It also suggests asking a friend or relative to come for support if you feel comfortable doing that. And if you're thinking about reporting the assault to law enforcement, the handbook advises asking someone to bring you a change of clothes, because the clothes you were wearing might be taken as evidence.
That's a really good practical tip that someone might not think of when they're going through something like this. The handbook also lists some questions that are typically asked at the hospital.
Yeah, those initial questions are usually along the lines of what brings you here, where and when did the assault happen, and what's your name, address, and age?
Wait.
Those are mostly to get the medical assessment started, and the handbook ends this section with a really important reminder. It directly encourages you to ask for a SACASA advocate if they haven't already been contacted. It says to ask the hospital staff to call the Southern Arizona Center Against Sexual Assault or call the crisis line yourself at 520-327-7273 or toll free at 800-400-1001. So it really puts that power in your hands to have that support there with you.
That's such an important reminder, especially within those first few pages. Let's talk about the medical forensic exam now, which the handbook covers from pages 3 through 5. What exactly is a medical forensic exam, and how is it different from just getting regular medical care after an assault?
That's a really good question. The main thing to understand is that a medical forensic exam is a very comprehensive medical exam, but it's done by a healthcare professional who has specific training as a medical forensic examiner. The purpose is to carefully document any injuries you might have from the assault and to collect forensic evidence like DNA that could be used if you decide to pursue legal action.
So it's more than just taking care of immediate injuries.
Right. While the handbook stresses that you have the right to medical care at any emergency department, it explains that the medical forensic exam in Pima County is usually done at specific places, Tucson Medical Center and Banner University Medical Center, because they have the trained examiners and resources. But it also points out that if you're in a situation where you're medically unstable and can't be moved, a nurse who's had forensic training will come to you to do the exam.
It's good to know, especially for anyone who might have serious injuries. The handbook also mentions a specific time frame for collecting those forensic samples.
Yes, because of the nature of forensic evidence, the handbook stresses the importance of collecting these samples as soon as possible, ideally within 120 hours, which is 5 days after the assault. It's also really crucial to remember that you have the absolute right to refuse any part of this exam or even the whole thing. It's completely your decision.
You're always in control of what happens during the exam.
Absolutely. The handbook also mentions that the clothes you were wearing during the assault might be collected, and that the samples gathered could potentially be used in a criminal investigation and prosecution if that's what you decide to do. Then it addresses a common question. Can just any doctor do this medical forensic exam?
And the answer is no, right? It takes specific training.
Exactly. The handbook is very clear that a medical forensic exam has to be done by a specially trained sexual assault forensic examiner who's often a safe nurse, but it could also be a nurse practitioner, a physician's assistant, or a physician who's completed that specific training.
So these are medical professionals with very specific expertise. Why would someone decide to have a medical forensic exam? What are some reasons?
The handbook lists a few key reasons. These include getting medical care from an examiner who is specially trained in this sensitive area, having a full head-to-toe medical assessment to make sure any and all injuries are identified and addressed, having those injuries officially documented in your medical record, and ensuring those forensic samples are collected right away in case you decide to go the legal route later.
And it's your decision to have the exam, right?
Yeah.
Regardless of what law enforcement might want.
You're absolutely right. The handbook is very firm on that point. It also talks about a common misconception, which is that a medical forensic exam will definitely prove that a sexual assault happened.
And it explains that it's more complicated than that.
Right. The handbook says that, sadly, many assaults don't leave behind visible injuries. And any injuries that are found could have been caused by other things, like consensual sexual activity or even previous physical trauma. But, and the handbook is very clear about this, that doesn't mean that an assault didn't occur. The absence of visible injury isn't proof that it didn't happen. Your experience is valid regardless of physical evidence.
That's so important for survivors to hear. If someone decides to have a medical forensic exam, how do they go about requesting one? What's the process?
The handbook lays it out pretty clearly. First, it says to tell the hospital emergency room staff that you've experienced a sexual assault and need medical care. It's important to know that everyone who works at a hospital in Pima County is a mandated reporter. That means they're legally obligated to notify law enforcement if a survivor of sexual assault comes in for treatment. But again, you don't have to talk to the police if you don't want to.
So, seeking medical care at a hospital doesn't automatically mean you have to interact with the police.
Exactly. Then the handbook says the emergency department staff should call a sexual assault response service, or SARS, advocate to provide emotional support during your visit. They even advise you to specifically ask the staff to call a SARS advocate if one hasn't been called already. The SARS advocate will then work with the forensic examiner to arrange for the exam. Lastly, the handbook reminds people that the SACASA crisis line is always there to answer any other questions or concerns you might have about the exam process.
It sounds like there are a lot of layers of support built into this process. What about the cost of the exam? That must be a worry for many people.
The handbook addresses that directly. It says that the medical forensic exam itself is free for the survivor. However, it points out that there might be separate costs associated with the general care provided by the emergency department staff, like labs, x-rays, medications for preventing pregnancy and STIs, including medications to prevent HIV. The handbook says that the advocate can help you understand those billing questions and talk with the emergency department staff.
Are there any other ways to get help with those costs?
Yes, the handbook gives information about Arizona's Victims' Compensation Program, which is managed by the Pima County Attorney's Office. This program might be able to help cover some of those medical costs. And, again, the advocate can help you understand the program and apply for it.
It really shows how valuable having that advocate there with you is. The handbook also touches on getting a medical exam after that initial 120-hour window for collecting forensic evidence.
Right. It makes clear that for medical reasons, like taking care of any injuries or health problems, an exam is always an option, no matter how much time has passed. However, it also explains that after that 120-hour mark, most of the forensic evidence that might have been on the body is likely gone.
So medical care is always possible, but the time frame for gathering useful forensic evidence is limited. The handbook also lists some things that can impact forensic evidence.
What's important to know is that over time, forensic evidence can naturally disappear, break down, or get contaminated, which can make it harder or impossible to test. Normal things like eating, drinking, smoking, bathing, combing your hair, or changing clothes can affect the collection of some types of forensic samples. But the handbook is really clear that doing any of these things won't stop you from getting a medical exam and the care you need. Your health is the most important thing.
So even if some evidence is affected, it's still essential to seek medical care. How long does a medical forensic exam usually take?
The handbook says it varies quite a bit depending on things like the extent of your injuries and how much you participate in the process. It estimates that the exam can take anywhere from about an hour and a half to as long as 6 hours. It does emphasize that the examiner will make sure you can take breaks as needed throughout the exam. Your comfort matters.
Being mindful of someone's comfort during such a sensitive and potentially lengthy exam is so important. What happens during the exam itself? What can someone expect?
The handbook gives a good overview. It usually involves giving a detailed account of what happened, a complete physical exam, a close examination of the genital and anal areas, which might involve a speculum or anoscope, and the collection of different biological or trace samples like swabs, blood, or urine. And again, the handbook stresses that you have the right to say no to any part of the exam that you're not comfortable with.
And what if someone doesn't want to go through a medical forensic exam at all? What other options are out there for medical care and support?
The handbook offers several alternatives. It first suggests calling the SACASA crisis line at 520-327-7273 or toll-free at 800-400-1001. They can give you information about other options for getting care and support. The handbook also says you can call your primary care doctor, an OB/GYN, an urgent care facility, or a local medical clinic. And it reminds readers that doctors and other medical staff are mandated reporters, but again, you don't have to talk to law enforcement if you choose not to. Lastly, the handbook really encourages everyone to get medical care and treatment, whether or not they choose to have a forensic exam. Your health and well-being are always the top priority.
So medical care and support are always there, even if you decide not to pursue the forensic route. Let's move on to page 6, which talks about possible medical issues that might come up after an assault, starting with preventing pregnancy.
This is a crucial topic, and the handbook offers vital information. It talks about emergency contraception, often called the morning after pill. It lists brand names like Plan B and Next Choice, and it also discusses the option of an IUD. It explains that emergency contraception helps prevent pregnancy after unprotected sex.
And how effective is it? What does the handbook say about that?
The handbook says that most emergency contraception pills work best when they're taken as soon as possible and can be 79% to 95% effective if taken correctly within 72 to 120 hours, which is 3 to 5 days, after the assault. It also points out that the morning after pill, like Plan B or Next Choice, is available over the counter at any drugstore without a prescription, and that goes for anyone of any age.
That easy access is really important. All right, what about the IUD?
The handbook explains that an IUD, for emergency contraception, has to be inserted by a doctor or other healthcare provider. It's a small, T-shaped device that goes into the uterus. It's a quick procedure that doesn't require an overnight hospital stay, and the provider should go over any necessary follow-up care with you. The handbook also has some really important general advice about medication, whether it's emergency contraception or any other kind. It stresses the importance of listening carefully to the doctor's instructions and never hesitating to ask the doctor or pharmacist any questions you might have.
That's good practical advice for anyone. The handbook also talks about whether you can still get pregnant even after using emergency contraception.
Yes, it makes it clear that while effective, emergency contraception isn't foolproof. It encourages anyone worried about the possibility of pregnancy to talk to their doctor. It also addresses a common misconception, whether emergency contraception ends a pregnancy that's already started.
And it says it doesn't, right?
Okay, that's right. The handbook explains that emergency contraception mainly works by stopping or delaying ovulation or by preventing a fertilized egg from implanting in the uterus. It does not end an existing pregnancy. It advises that if you think you might already be pregnant and have concerns, talk to your doctor to get all the information and support you need.
The next section, on pages 6 and 7, focuses on sexual assault follow-up care. What kind of advice does it give on how to help your body heal?
This section gives practical advice on how to take care of any physical injuries. It talks about caring for cuts, scrapes, and abrasions, and really stresses washing your hands well before touching any wounds. It recommends keeping wounds clean with mild soap and water, keeping bandages clean and dry, and applying gentle pressure to stop any bleeding. It also says that a little bit of antibiotic ointment might help prevent infection. For stare strips, those thin bandages, it says to leave them on for at least a week. And it lists specific warning signs that mean you should call a doctor, like increased warmth around the wound, redness or swelling getting worse, red streaks spreading from the wound, pain getting worse, or any pus or drainage that smells bad.
That's good, clear advice on how to care for yourself physically. The handbook also specifically addresses genital and anal injuries, which can be a tough topic to talk about.
Yeah, it explains that these types of injuries, which can include bruises, scrapes, and tears, are pretty common, unfortunately, and can cause some pain and bleeding for a day or two. But the good news is they usually heal pretty quickly, often within 2 or 3 days, without needing any special treatment. For taking care of these injuries, it recommends gently keeping the area clean and dry to prevent infection, applying cold packs wrapped in a cloth for about 20 minutes at a time, up to 4 times a day for the first few days to bring down swelling. It also suggests over-the-counter anti-inflammatory medicines for pain. It mentions that anal injuries can involve bruising, tears, and possibly longer-term effects like scarring.
Now, pages 7 and 8 cover something really serious, potentially life-threatening even, strangulation.
This is such an important section because the effects of strangulation can be so serious, even life-threatening, and often there aren't immediate visible injuries. The handbook clearly defines strangulation as a type of choking that involves pressure on the blood vessels and in airways in the neck. That pressure can really mess with the flow of oxygen to the brain, which can lead to serious problems. It's important to know that this is different from choking on something you've swallowed, which is usually a blockage of the windpipe by a foreign object.
And the handbook makes the point that the signs of strangulation might not show up right away.
Exactly. It lists a bunch of signs and symptoms, and some of them might not show up until later. These include things like a hoarse voice or losing your voice completely, having trouble swallowing or pain when you swallow, scratches, scrapes, redness, or any marks on your neck, scrapes on your chin, and tiny red or purple dots on your face, neck, or eyes, which are called petechia. Because there's a risk of serious problems that might not show up immediately, the handbook urges anyone who's been strangled to have someone stay with them and watch them closely for the next 24 to 72 hours.
That really highlights how dangerous it can be, even if it doesn't seem like a big deal at first. The handbook also gives very clear instructions on when to get emergency help after being strangled.
Yeah, that's vital information. It says to call 911 or get to the nearest emergency room immediately if any of these things happen. If you lose consciousness, even for a short time, if you feel lightheaded or dizzy, if you have trouble breathing or feel short of breath, if you have a cough that won't go away, or if you're coughing up blood, if you lose control of your bladder or bowels, if you have trouble swallowing or feel like there's a lump in your throat, if you have muscle spasms in your throat or neck, if your voice changes in any way, if you have a hard time speaking or understanding what others are saying, if one of your eyelids is drooping, if you have a hard time walking or coordinating your movements, if you have a new headache that doesn't go away with over-the-counter pain relievers, if you have a seizure, if you experience new weakness, numbness, or tingling on one side of your body, if you see pinpoint red or purple dots on your face or neck, or if you see burst blood vessels in the white of your eye, if you notice any changes in your behavior, or you experience memory loss or confusion, or if you have thoughts of harming yourself or others.
That's a really important list of red flags.
Definitely. And even if you've already seen a doctor, the handbook recommends keeping track of any changes in your symptoms, no matter how small, and telling your doctor and law enforcement if you're working with them. It also strongly recommends a follow-up appointment with a doctor 1 to 2 weeks after the strangulation.
On page 8, the handbook shifts to the topic of sexually transmitted infections.
This is another major area of concern after a sexual assault because there's a risk of getting an STI from bodily fluids. The handbook explains this and stresses that not all STIs can be prevented. It strongly recommends not having any sexual contact or always using a condom if you do until you've had a follow-up exam and been tested for STIs.
What kinds of infections does the handbook mention specifically?
It talks about bacterial infections like syphilis, gonorrhea, chlamydia, bacterial vaginosis, and trichomoniasis. It explains that the examiner or emergency room doctor will assess your individual risk based on what happened and may offer preventive medication. And it emphasizes the importance of finishing all the medication even if you start feeling better. The handbook also talks about HIV, saying that the forensic examiner can talk with you about your risk. It highly recommends getting tested for HIV right after the assault and then every 6 months for the following 18 months, since it can take a while for HIV antibodies to show up on tests. And it gives contact information for local resources that provide HIV testing and information, including your primary care doctor, the Pima County Health Department, and the Southern Arizona AIDS Foundation.
And the handbook stresses how important those follow-up visits are, especially when it comes to STIs.
Yes, they highly recommend follow-up exams. These appointments let your doctor look for any new infections that might have happened during or after the assault, complete the hepatitis B vaccine series if you need it, provide counseling and treatment for any STIs that are found, and keep an eye on any side effects or help you stick to any preventive medications you've been prescribed. The handbook specifically recommends getting another STI exam 1 to 2 weeks after the assault.
Pages 9 and 10 have a really useful checklist for follow-up medical care, and it also lists those CDC-recommended regimens for preventative medications.
That's right. This section acts as a clear roadmap for the recommended follow-up care. The checklist really encourages you to get all of the care that's listed, and it says to talk to your primary care doctor to make sure those recommendations are right for now. For as soon as possible, within 1 week, It lists some baseline tests, an HIV test, a pregnancy test, an evaluation for any infection, and a hepatitis test. For 1 to 2 weeks after the assault, it recommends a hepatitis vaccine and another check for infections. In 1 month, it says to get a pregnancy test, another hepatitis vaccine dose, an evaluation for infection, and another HIV test. In 3 months, it lists HIV and syphilis testing, and in 6 months, it recommends the final hepatitis vaccine dose and a final HIV test.
That's a really well-organized timeline for follow-up. What about the CDC recommended medications that are listed?
The handbook gives a list of these medications, which are based on guidelines from the CDC from 2015. For preventative antifungal treatment, it lists metronidazole or tinidazole, and it gives the recommended dosage. For antibiotics to prevent bacterial STIs, it recommends ceftriaxone, which is given by injection, along with either azithromycin as a single oral dose or doxycycline taken twice a day for 7 days. It also lists ondansetron for nausea, Plan by One Step for emergency contraception, and a few different options for PP, which stands for post-exposure prophylaxis, to help prevent HIV. It also mentions lidocaine for topical pain relief. It's really important to emphasize that using any medication should be discussed with and supervised by a healthcare professional.
The last part of page 10 has a section called Record of Your Reporting Information. Why is it so important to keep track of all that information?
It's a really helpful section meant to help survivors keep all their important contact information and details in one place. It's super useful because things can feel really overwhelming and confusing after an experience like this. It gives you a place to write down things like any police case numbers, the name of the detective or officer you talk to, the first name of your advocate, and any other advocate who's helping you, the agency your advocate is from, with contact information for both SACASA and the Victim Services Division at the Pima County Attorney's Office, the first name of the sexual assault forensic examiner who did your exam, the examiner's agency, which is SACASA, and the location and phone number of where you had the exam.
Sounds like a really useful tool for keeping track of everything that's happening. We've covered so much crucial information today from the first 10 pages of the SACASA Survivor Handbook.
Definitely. We've gone over the immediate steps to take after a sexual assault, the importance of seeking medical attention, what a medical forensic exam involves, details about follow-up medical care, vital information about STIs and pregnancy prevention, and the role of support systems like SACASA.
The main takeaway is that help is available. You don't have to go through this alone. If you want to dig deeper and see a full list of resources, be sure to visit SACASA's website, which is sacasa.org.
I second that. We really encourage you to visit sacasa.org. You'll find more detailed information, a full list of resources, and ways to connect with their incredible support services. You're not alone, and there is support out there for you.
It's so important to remember how strong and resilient survivors are. Healing and recovery are possible. Be kind to yourself, and don't be afraid to reach out for help.
And just as one final reminder, the SACASA crisis line is always available, 247 at 520-327-7273, or toll-free at 800-400-1001. You can always get help by phone or by visiting sacasa.org.
Thanks for listening, and we'll see you next time on The Deep Dive.
Thank you.